The First Aid for Common Accidents and Injuries by Muhammad Nekmetin. What is first aid? First aid is emergency care given immediately to an injured person. The purpose of first aid is to minimize injury and future disability. In serious cases, first aid may be necessary to keep the victim alive. What is identification needed for doing first aid? First is the number of employees, the type of hazards, and the travel distance to a hospital. There is 4 basic things that we need to know about first aid. First is the procedure that to be followed, location of the first aid room or the first aid kit, emergency contact list, and the location of the nearest medical facilities. Now, let's see what are the basic things inside the first aid kit. Every first aid kit should contain of plasters from different sizes and shapes, large sterilized gauze, triangular bandage, crepe roll bandage, safety pins, disposable sterile gloves, tweezers, scissors, alcohol-free cleansing wipes, sticky tapes, thermometer, skin rash creams, spray to relieve insect bites, antiseptic cream, painkillers, distilled water, and eye wash. Okay, now we see what does first aid room have. Every first aid room should have a sign to advising their names, a sink with hot and cold water running, drinking water with disposable cups, soap and paper towels, store of first aid materials, stock of portable first aid kit, food operate reuse container to dispose the clinical waste, an examination or medical couch with waterproof protection, telephone or communication equipment, record book, and wheelchair or stretcher. Okay, now we see the basic procedure on how to treat the minor injury or accidents. First is bleeding. For bleeding, the first step we should do is call 911 for medical assistance. Keep the victim lying down. Apply direct pressure using the clean cloth or sterile dressing directly on the wound. Do not take out any object that is lodged in a wound. If there is no sign of fracture in the injured area, carefully elevate the wound above the victim's heart. Once bleeding is controlled, keep the victim warm by covering with a blanket, continuing to monitor for shock. Now is the basic procedure on how to clean a wound. First step is wash your hand and clean the injured area with clean soap and water. Apply antibiotic ointment to the minor wound and cover with the sterile gauze, dressing or bandage that is slightly larger than the actual wound. Next, basic procedure for eye injury. If an object is impaled in the eye, call 911 and do not remove the object. Cover both eyes with sterile dressing or eye cups to immobilize. Covering both eyes will minimize the movement of the injured eyes. Do not rub or apply pressure, ice or raw meat to the injured eyes. If the injury is a black eye, you may apply ice to the cheek and area around the eye, but do not directly on the eyeball itself. Now, basic procedure for burning. Submerge burn area immediately in the cool water until the pain stops. Remove all the jewelry or accessories on the victim. If the affected area is large, cover with cool wet cloth. Do not break blisters if they are present. If medical attention is needed, do not apply any cream. Just cover with a dry, sterilized dressing and seek medical help immediately. Basic procedure for choking. First step, we need to ask the victim, "Are you okay?" Do not interfere or give first aid if the victim can speak, breathe or cough. If the victim cannot speak, breathe or cough, ask for someone to call 911 and then perform the Heimlich maneuver. How to perform the Heimlich maneuver? Position yourself behind the victim with your arms around the victim's stomach. Place the thumb side of your fist above the victim's navel and below the lower end of the breastbone. Take hold your fist with your free hand and pull fist up and in, quickly and firmly. Continue with thrust until the object is dislodged or airway is clear. Lastly, basic procedure for injury from animal bite. First, control any bleeding by applying direct pressure or with elevation. To avoid risk of infection, do not close the wound. Rinse the bite thoroughly, holding it under running water. Cleanse with soap and water and hold under water again for 5 minutes. Do not put ointment or medicine on the wound. Cover with dry sterile bandage or gauze. Seek medical assistance